Welcome to Chokeholds Chill. I'm Jenn, middle-aged grappler, coffee addict, and proud owner of the world's ugliest armbar.
And I'm Mallory, your training partner who's always laughing, even when being absolutely smashed, submission lover, and early bird fundamentals coach.
Here on Chokeholds Chill, we dive into the lives of our favorite sparring partners, the highs and lows of training, and what it really means to chase big dreams on and off the mats.
But it's not just about jiu-jitsu. We're here for the laughs, the lessons, and the moments that remind us why we love this crazy sport and this crazy life.
We're here to talk about the good, the bad, and the hilarious, because let's face it, the mat teaches us more than just arm bars and mount escapes.
It teaches us about ourselves and how to navigate through life while being a part of an incredible community of people.
I mean, that's how we met.
Whether you're a seasoned competitor, a white belt finding your footing, or someone who just loves a good story, this podcast is for you.
It's about the roles we take, the people we meet, and the lessons that stick with us both on and off the mats.
So grab your gi, tie your belt tight, and get ready to roll with us.
This is Chokeholds Chill. Let's get into it.
This nurse blew out my freaking vein on Wednesday for blood draws. So
I was wondering what that bruising was. I saw that on your story and I was like, what the hell?
Ridiculous. I was at Victory and I met Jocko for the first time yesterday and he's just like, what the hell? Because my whole arm is purple. I was like, pre-deployment blood draw. He was like, are you kidding me?
Oh my gosh.
All that for 10 cc's of blood and then I probably let out 10 liters in my freaking arm.
Oh my gosh. Yeah, your poor arm.
And they hurt too. I don't like that.
It does hurt. Yeah, so I was training yesterday and people were grabbing it and I just kind of was like, nope.
I'm sure it feels really good now.
Ugh, it's still bad. We went to open mat this morning at our gym at home and I was like, I just watched my fiance roll. I was like, I'm good.
Yeah.
What level is your husband or is your fiance?
He's a blue belt.
He's a blue belt. Awesome.
Yeah.
I love that. Do you just love beating up on him all the time?
No, because he's 200 pounds. So
how big are you?
Beat him up. 125.
125. Oh, yeah.
Okay.
Yeah.
We're close to that.
You guys would be a good size to fight each other.
Yeah.
Yeah. Much better.
Yeah. Jen's a fresh brown belt as of a couple weeks ago. So you guys are
congratulations.
Congratulations to you.
Yes. We have so much to talk about with all of
Let's
this.
Get into it.
Yeah. Let's jump into it. Welcome back to Chokeholds Chill. We have a very special guest today, Dr. Meagan Jimenez. She is a board-certified orthopedic surgeon, a U.S. Army major, and a freshly promoted black belt in Brazilian Jiu Jitsu. She's also the founder of Dr. Jiu Jitsu, where she works with combat athletes, special forces, and high performers on injury prevention, recovery, and performance optimization. Meagan, doctor, thank you so much for being here with us.
Welcome.
Yeah, thank you guys. Thanks for having me.
Yeah, we are so excited that we stumbled across each other on Instagram and love your content, love your page, and you have just such an interesting story. So we want to dive in and learn more about you.
Let's do it. Yeah. Tell us a little bit about where you're from. What was your life like growing up? And I want to hear some of your athletic background before jiu-jitsu, because I know it's pretty extensive.
Yeah, it's pretty funny, actually. I was just organizing some of my diplomas because I have some karate black belts. When I was way younger, I started with karate out in New Jersey, which is where I grew up. My parents came from Cuba, so I'm first generation American. And we grew up all Jersey Shore. So that's where I spent most of my early life until college. When I went to University of Southern California, I went across the country because I wanted the beach all year round. That's pretty much how I chose my college. And then it ended up being a great college. But I did karate since I was about 5.
Wow.
My mom tried to put me in ballet, and I hated it. I was 5, and she bought all the outfits, spent all her money on my outfits, and I would just sit there miserable.
Oh,
my dad went to one. My dad went to a recital once, and I just sat there with my hands crossed pouting, and he goes, is this what it's like every time? And my mom said, yep, that's what she does. It's fine. And so my dad was like, yeah, we're not doing that. And so kind of like him, my grandpa, a bunch of my family members put me in karate, which I think was just right above the ballet studio.
Mm-hmm.
And that was kind of what I did for the first, I would say 12 years until I went to college. I did
Wow.
karate and I went up the ranks, started teaching at a very young age, which was, it's challenging as a 16, 15-year-old. Even I think I was 12 when I earned my first degree black belt. And that was trying to teach adults from a 12-year-old's perspective. That wasn't, that was intimidating, you know?
Yeah, what an interesting dynamic.
Yes.
Yeah, I didn't teach much with the adults, but sometimes they would try to have me do little things and build some confidence, I guess.
Yeah.
Sure.
At that age, yeah.
So this has really been ingrained into you, like your whole life, like being in like roles of coaching and teaching and leadership, which is clearly, you know, been throughout, it's now into your adult life. So that's really cool.
Yeah, and martial arts has always been a part of my life.
Yeah.
I love it for everything it's taught me. Just like the discipline, respect, you know, for you, for others, and having a community. And it's been just a tremendous part of my life.
Yeah. And then we were looking at some of your information on your website, and it mentioned like a bunch of other martial arts and combat sports that you've kind of dabbled in. So when did you start training in those and stuff as well? Because I know karate was the first. When did you start cross training other sports?
Yeah, karate was the first, and then my dad was doing some like kickboxing when I was in high school, so I started doing some kickboxing with him at another local karate school, just kind of for cardio more so. But then I went to college, and they didn't have Kenpo, which was the martial arts that I was familiar with, and I heard about some boxing team at USC, so I joined, and I had a very small stint in amateur boxing, but I didn't like getting hit in the head. Like you enjoy it a little bit. When people would hit me in the head, I kind of would get that weird smile on my face. It's like, on, you know? But getting hit in the head, I was like, I'm going to be a doctor, I think, and maybe not. So it was it was short. It was like 2 years or so in college. And then I picked up Muay Thai a little bit in medical school. But Muay Thai was super fun. I never competed. I just trained. And then as I kind of kept doing stand up for fun, not so much for competition, I saw people rolling around in gis, which is, I had a gi in karate. So I was like, okay, this looks a little bit more familiar, but I don't understand what they're doing all over the floor, without striking. And I kind of bought a $40 Fuji gi on Amazon and went over and then I never looked back. And that was when I was an intern in residency. So around 2014.
Wow.
Oh my goodness.
That's incredible.
Yeah. Great story.
So let's rewind just a little bit. So you went to USC, right?
I did.
Did you know from like early on, like, did you always know that you wanted to go into surgery?
I always wanted to be a doctor of some sort. I wanted to be a vet for a while. And then I didn't love cats. So I was like, okay, probably not a vet. I was like, I just want to treat dogs and horses. And like, that's probably not going to work. And then I just kind of found a love for medicine in general. And actually, one of my high school teachers, my anatomy teacher, was phenomenal. And she, during lunch one day, showed a knee replacement video. She said, hey, if anybody wants to come, I'm going to show a video of a knee replacement. So guess who was the only one in there?
You.
I would have gone.
Yes, I'm sitting there eating my lunch, like full on, just eating lunch while they're hammering away, sawing bones. And I was not grossed out. I was like, this is so cool. So it kind of helped me go towards surgery. And my dad's a businessman. He started a business when he came from Cuba. I just had no interest. It's like, somebody's got to take over my family business. And I was like, well, that's not going to be me.
Yeah.
I thought the thought of helping people and even cutting people open seemed very cool, like to be able to fix people with your hands and your mind.
Yes.
And so I kind of was like, okay, we're going to go medicine. And then I figured it out during medical school. I was like, do I want to be a surgeon? It seems a lot tougher, a lot more hours. But every time I did something that wasn't surgical, I wasn't really fulfilled.
Yeah. That's amazing.
Yeah.
That's a pretty powerful moment too.
Yeah. How many years total of school, residency, and everything?
Including undergrad, I think it's about 15 years.
Wow.
Yeah, it's
That
a ton.
is dedication.
So
I know people were like, "Hey, could you talk to my daughter or my neighbor's kid about being a surgeon?" And I was like, "Look, I think I might talk them out of it. You know, it's a lot. It's a lot
You
to
got to
do
really
that.
want it.
Yeah,
So
you do, and you have to
somewhere,
be a student. Like, just be a student always, and be willing to always be learning, always be studying. And you have to, unfortunately, all these tests and things, I have my opinions about it being necessary to be a doctor. Like, do we need that much?
right?
But it's kind of just part of the process.
Yeah.
Yeah.
So you also somehow ended up in the Army in all of this.
Yes.
When and how did that take place?
So I went, I did my medical, it'll make more sense, like, as a part of my medical career.
Okay.
All my medical school residency was in New Jersey, like Jersey, Philly, Delaware area. I did all of my training at Rowan University. And then I did a fellowship in sports medicine at WashU in St. Louis. So I went to the Midwest for a year. COVID hit, and I was trying to figure out where I was going to get my job. And I had a bunch of great job opportunities that came up before COVID. And I was going out for interviews with private practices in Florida and Texas, some really great opportunities that they kind of went away because when COVID hit, nobody could afford to take on new partners because all the elective cases were going away.
Right.
And I'm a sports surgeon, right? So we weren't really treating many ACLs or rotator cuffs or the surgeries that I do during the heat of COVID. We were just doing traumas and necessary things. So Emory in Atlanta, just outside of Atlanta, they offered me a job before COVID. I was going out there to see them. They were like, same job, same everything, even with COVID. And I was like, I'll take it. And at that time, I had always kind of had a thought of the military and wanting to serve, wanting to wear the uniform, like wanting to do cool guy shit, essentially. And I was like, I could see myself doing this. And I kept coming back to it. And people would always ask if I was in the military because I kind of walk around that way. No, but I thought about it. And I talked to a recruiter at the time that just didn't seem like the right time. They're like, yeah, like you kind of are owned by the government and we'll send you where we need you. I was like, all right, you're not really enticing me right now.
Right.
So Emory had a great job, took it, had a great 3 years there, loved it. Really developed myself as a surgeon. Didn't have residence. It was me developing my practice and just learning what works, learning what doesn't, and finding my stride. But I kept coming back and back and back to the military. And the general population wasn't fulfilling me as much because I'm a sports surgeon. And so I had a lot of patients that were obese, drinkers, not sleeping, not working out. And I felt more like a life coach / personal trainer / nutritionists, like all these other things, which are all great and good. I just wanted to do that more for an athletic population.
Right.
So I was like, what better than to do that for soldiers? And when you're in the Army, it really is a lot of sports cases. I always have a wait list because everybody's hurting their shoulders, their dislocating shoulders, tearing ACLs, meniscus, all these surgeries I do. And so I finally said, it's time. I keep coming back to it. And I don't want to die with any regrets and anything left on my list. So it's kind of like another thing that I wanted to do that I finally did.
I think that's so incredible.
Yeah, this is such a great story of how it came to be too.
So what year was it then that you went into the Army?
I just joined last year. I actually just hit my 1 year mark.
Wow. Well, happy 1 year anniversary.
Thank you.
That's incredible. So
oh my gosh, congratulations.
Yeah. So I feel like these are like such like 3 huge paths that are like a whole life, right? So you have like these 3 lives that are all like kind of converged and showed up at different points, but developed together. And there's a lot of crossover with each of these things, right? Medicine, time, dedication, patience. Jiu-jitsu, time, dedication, patience.
Yes.
Like the military, you're at the start of that. So how do you feel at these different points on the path of each of these lives that you lead? Does that make sense? Is that a loaded question?
No, they're all very interconnected, I think. And one of the commonalities is that they're all male dominated fields.
Oh,
And
yeah.
I've always been drawn to that, I suppose. Like people, I've had women talk to me a lot about like, oh, like we need these places to hire more women and like be more open. And I was like, listen, if somebody doesn't want me there because I'm a woman, I don't want to be there either.
Yeah.
Right? So I have a lot of opinions about being a woman, and I kind of just go, I'm like one of the dudes. I'm like, all right, let's do it. Like whatever we got to do. And I'll show you all up if I need to, like, let's go. And that's like kind of my personality, which I think helps in like the military, in jiu-jitsu, in orthopedics, where orthopedics, I think a recent statistic was like 6 to 7% females.
Wow.
And so it's not a lot. We're getting there, especially in medical school. I think it's about half and half now. I think a lot of females just don't go into orthopedics, but I've always been drawn to these male dominated fields.
Yes. And I will say, so I work in healthcare. I'm an occupational therapist, and I did travel for years. So in everywhere that I've ever been, I have never met or worked with a female orthopedic surgeon. So I was very excited when I saw your page. I was like, what a badass, like female empowerment. So I like love that.
Yeah. I've actually never seen one. Like I've never, like through all my injuries, I've never seen it even as an option, like anywhere.
That's funny.
Yeah.
Yeah. I mean, it's much more
crazy.
common now. I think I have about 12 partners in the Army, and 2 of us are females.
That's
so
great.
not terrible, but it's myself and a hand surgeon. And we're just like part of the crew,
Wow.
Yeah.
That's so awesome.
So with that, you're working with pretty high level athletes, really elite athletes and operators. How has your experience in the military shaped your approach to how you treat and train high performers?
I think I've always had a passion for treating athletes, but on the civilian side, I treated more high school, college level.
Okay.
And it was different sports. So it was like basketball, football, volleyball, soccer. Those were kind of my more common sports. And now I'm treating more combat, right? So people jumping out of airplanes, people rucking out in the woods, twisting their leg, wearing 100 pounds of gear, and their ACL goes out. So it's a little bit of a different injury pattern.
Yes.
But this was kind of what I wanted. And I treat a lot of jiu-jitsu athletes too, because but many do jiu-jitsu in addition to being a soldier.
Okay.
And the special forces guys actually have on base, they have like a jiu-jitsu room, and they have a dedicated coach who is the man, and he just does all their combat. So he does all their like weapons training, like their combatives training, and then he teaches jiu-jitsu. So I go do class sometimes with them, and then I'm treating these guys because they're all special forces guys. So I think it's pretty cool that I'm getting to treat such a high level, and they are all high level, and they all want to get back for the most part.
Yeah.
They want to get back to doing what they were doing and go back to being deployable and go back to fighting.
Yeah. And I think that it makes a huge difference when your healthcare providers, when they can relate to you. So like they see you, their doctor, doing all of the things, doing the combat training and I've also like know that you have injuries in your past. You've torn an ACL, right? And you've mentioned a shoulder surgery recently.
Yeah. I tore my biceps about 3 months ago.
Holy cow. Yeah. So, I mean, you've been there. That makes such a huge difference. I mean, how many times do you I have a local orthopedic surgeon. He retired now, but he's like the unhealthiest. Like he doesn't look like he could like lift his arms over his head. So like, it's like, you want to go to a doctor and be like, yes, like I trust this person because they're doing it too.
Yeah.
And they can show that.
Well, they know you're not going to feed them full of bullshit.
Right. Well, I want to see that, like, even when I go to the doctor, right, if I go to a family doc looks super unhealthy, overweight, I'm like, I'm not listening to what you're saying as much because you're like, yeah, you got to eat this or that. I was like, like, literally, you hate to be all judgy, and it's like, you got to walk the walk if you're going to be preaching this. It's not one of those like do as I say kind of things.
Right.
And that is something these experiences are very valuable to me. Like, I don't wish I had torn an ACL by any means. That was the hardest recovery I've ever gone through.
Sure.
And like ACL, the actual surgery, I tell my patients, that's the easy part. Like not that surgery is easy. It's just that, we can get you a new ACL and do a nice job, but then you've got 9 months to a year that you have to be working every day. Like, even if it's not on your knee, it's on your mind, it's on recovery. It was aggressive. So having gone through these different surgeries, all the surgeries that I do, I've had 3 surgeries, all that I do, it's changed how I approach recovery. It's changed how I like their recovery. It's changed how I approach their preoperative, what I talk to them about, completely changed because I've gone through it now.
Yeah, that's incredible. I mean, it's something that obviously you don't want to go through, but how it's benefited you so much just having those experiences and being able to relate and understand from the other side of things.
I also feel like what a gift to medicine, like to be able to offer that insight.
It's totally different. And I post about it on my social media. Like when I had my ACL tear, I was posting videos like 2 days after surgery, 1 week after ACL surgery. And it's nice because I can send my patients there. I'm like, hey, go to my Instagram at this time in my life, 2023, when I had my injury. And you can go through and see exactly what I did up until like 6 months, 9 months, because I did videos of me doing PT, me working through it. And they can see the exercises that we're doing and kind of get like a little baseline or just see what they can and can't be doing.
Right. And then it's like you can look back on that and be like, yeah, I did that.
Yeah.
And like just seeing how far people have come is always so like rewarding. So that's so cool.
Have you had any like of your injuries that you treat as an occupational therapist?
I for the past like 5 or 6 years, I specialize in lymphedema and wound care. So that's my primary focus right now. But I actually have not really personally suffered any serious injuries like in the ortho world, which is very nice.
Lucky bitch.
I had a weird freak accident in which I severed one of the flexor tendons in my arm because I put my arm through a window. That's a long story. But that's like the only serious injury that I've ever had.
But that's an occupational therapy type injury.
Yes. And that was before, that was before I ever trained jiu-jitsu. So it's just interesting. But yeah, so it's so funny.
I'm over here dumbfounded. Like, wait, I just heard that story for the first time.
Oh, did you not know that?
No, we'll talk about that later.
Yeah. That needs to be an episode, I think.
Yeah, I think so.
It was wild. Like my arm was wide open and I could see my severed tendon just flexing back and forth. I was like, this ain't good.
Yeah.
Go off.
But anyways.
So back to the podcast.
So what?
It's my fault.
No, that's okay.
This is all sane.
Yeah. So what is one thing that you wish more athletes knew about injury prevention, especially combat athletes?
I think specifically when you're younger and even older, like still people have a difficult time with it, is the recovery aspect. When I was younger, I was pretty bad at this. When I was in my 20s or even when I was like 32, I went to Masters Worlds and I was just like putting my head down, like full on pedal to the metal. Like I just didn't even care about anything. And I just was training my heart out because I was like, I don't want to have any regrets, but I wasn't recovering well. And I remember one time I hurt my neck pretty bad and I couldn't turn left or right, numbness, tingling in my arm. It was pretty bad. I had a nerve that pinched and I was set to train like 7 hours that weekend. Friday, Saturday, Sunday, I had set times. I was going up to Atlanta to train with some of my friends at Roberto Travin's gym, and I had all these plans. And Friday came around, and it had happened like Thursday. So Friday, I was like, I've got to train. And I went to my physical therapist, and they were like, you need to not train today. Like, your arm is lit up. And I was like, it's fine. I have Worlds in 2 weeks. This is my weekend. And then I went to my massage therapist. He's like, yeah, you're not training tonight. And so it took a lot of people to tell me, like, as an orthopedic surgeon, I'm supposed to know this stuff. And I didn't care. I was that athlete brain of just do more, sleep when you're dead. And, it definitely took a toll on me. And finally enough people told me not to train that I took that night off. And just that one night off of like eating well, getting a massage, just sitting on the couch, just relaxing, going for a walk with my dog and sleeping 10 hours, I was able to train over the weekend. I just hadn't been recovering. And that's the biggest advice I give to people is recovery is nutrition, it's sleep, it's mindfulness, it's so many things, but we don't value any of that because we're like, no, we need to put in more work, we need to train more, we need to do more. Right. When sometimes it is less. So that's the biggest advice I have. And now I'm finally like slowing down a little bit. If you ask my fiance, he'll say I'm not slowing down, but well, you didn't know me 10 years ago.
No, we talk about it a lot though, like how burnout in the sport is real if you just push it too much. So recovery is so important, especially as we are not teenagers and in our 20s anymore.
No, or in your 30s anymore. Gosh, I've passed that out.
So we want to shift gears into your most recent accomplishment, getting to the black belt milestone. Woo! Congratulations.
Huge.
Thank you.
You kind of already touched base a little bit about when you first started and, what that looked like, but can you kind of go into that a little bit more? Tell us about the first time you went to a jiu-jitsu class. What was that like for you?
Yeah, the first time was actually at Web MMA or Web Fitness. At the time, oh my gosh, I think it was a UFC gym when the same coach though, Jonathan Webb, he was my the OG. I started with him as a white belt in 2014 and it was in New Jersey. I was in residency. I was an intern and I just saw it and I was like, you know what, I'm just going to do it. I'm going to start. And I remember going to this class with a bunch of teenagers. It was all a bunch of white belts. And then there were some people that were a little bit more advanced. I think my buddy Kevin was like a blue belt. He's, I think, a 2nd degree black belt now. And so it's just looking at the people that stayed is pretty funny because we were babies. Like I was 24, 25, but it was a lot of teenagers that were in the room. And yeah, I thought it was pretty cool.
I love it.
Kept bringing me back. And a couple months in, I actually hurt my shoulder, not tapping, like a knucklehead. And it was, 2 white belts going at it, which is never smart. And it's like, I didn't tap. And then I was like, oh, my shoulder kind of hurts. And then, it kept hurting, ended up getting surgery. And at that time, everybody told me, you can't go back. It's irresponsible if you go back. You're a surgeon. You're given these gifts. And so I was pretty down for a while because I was like, well, damn, I got into this sport I absolutely adore. And now I can't go back. And so the guy who fixed my shoulder, Brad Bernardini, he was a mentor of mine, still is. He was like, you can go back. Why wouldn't you go back? I was like, well, everybody tells me not to. He's like, hell no, you go do what you love. And so I thought that was really cool. And that's kind of the surgeon I've come to be, where I have a lot of patients that say, well, after this, I can't do this anymore, right? I was like, the purpose of us treating you is so you can do that again.
Yes.
It's very rare that I will say no. Sometimes you have. Sometimes there are things that are like, listen, you might not be able to do that, but it's very rare for me as a surgeon. Yeah. So, yeah, I mean, that was my first class. And then it was a lot of on and off because of residency. And when you're on trauma rotations, working 100 hours a week, you don't really make it to jiu-jitsu.
Yeah, so, I would imagine.
Yeah. So I had a really good coach that I was like, hey, I'm probably not going to be here for a couple months every year because of XYZ. He's like, all right, just tell me when and I'll freeze it and then tell me when you come back.
That's great.
It was nice. So that's always the advice I give to med students and residents. I'm like, you can do it. You have to just have a gym that's going to support you not being here, not charge you like freezing fees and all that.
Yeah. Yeah. It sounds like you had a good environment training in, which is great.
Oh yeah. That was amazing. And every time I go back to Jersey, I'm actually going back this weekend and I was like, hey, can I teach a class? And my professor calls me. He's like, hell yeah. Like,
that's awesome. I love that.
Yeah. Yeah. So it's a really good environment and he's always supported me. Like I went back, I tore my ACL in a competition in New Jersey. And I went back for the weekend and I was like, hey, I'm competing in this absolute tournament. Can you coach me? Jonathan's like, hell yeah.
Oh, that's
so great.
Yeah.
That's really cool. What a great coach to have.
Oh,
so looking back on your jiu-jitsu journey, what are some of the biggest lessons or turning points for you? It sounds like you had a really supportive or do have a really supportive coach. But what are some big takeaways thus far?
One of the things I've always talked about is how many phenomenal male role models I've had. I know, like recently, also there have been men that maybe aren't doing the right things at gyms, and I've always heard of this.
Right.
I've never personally experienced it because I've always had the best male mentors and coaches. So, we a lot of times, like even with most recent stuff, I don't know if you've seen what's coming out of like Texas, some of this stuff.
Oh yeah.
Yeah. So like even with some of this stuff, I think that this stuff gets a lot of attention, which it should. And what's maybe more important is giving attention to the men that are phenomenal.
Absolutely.
Like I have had just these tremendous guys between Jonovan, and then I went to St. Louis and I trained under Kyle Watson, and then I went to Georgia and trained under it used to be a Gracie Baja, and now he switched it to a Rubicon, but Josh Bolin. And these guys, and they've just been like such amazing mentors and role models, and they just support everyone at the gym. Like, doesn't matter what you are.
Yeah,
and
I've had the
that
same
to me has been
experience.
so cool. Yeah, like I haven't had the other side, and I'm pretty grateful for that. But I think there's many more men like this that need recognition. And,
Absolutely.
And then, like last weekend or yesterday, I was over in San Diego at Jocko's gym, and the community was freaking tremendous. Like they were so welcoming. I could roll with the guys, I could roll with the girls, and nobody was out to just like, murder you or do anything crazy. And it was just a very welcoming community. So that to me
great.
is jiu-jitsu.
I love that. We love hearing that that's women's experiences, because that's for both of us too.
Right.
Our community is really, really supportive, but you hear these stories all over, and also like in the Army too, you hear crazy stories as well, being a female in the Army. So yeah. Do you feel like there were ever times like in your jiu-jitsu journey that you felt like giving up?
Oh yeah. Especially every injury that happens. Like anytime I get an injury that's a bigger one, I'm like, man, I need to just stop. It's like you are a surgeon and you have these surgeries and then you're out for the count for a month. Because every time I have surgery, like the 3, I don't operate for a month. And so that's a lot of patients too that I'm like, I feel like I'm letting down a bit,
Sure.
And people had surgery dates and then I had to call and be like, hey, I had surgery. You can move to one of my partners or it's going to be delayed a month now. And a lot of them actually stayed with me. It was kind of funny. They were like, no, we want you. And
That's great.
My office wasn't telling people that I was getting surgery. So then they would ask, did Dr. Jimenez hurt herself? And my office is like, we can't really say anything. Like, you could talk to her. They're like, she hurt herself doing jiu-jitsu, didn't she? Because all my patients know. That's what I do, So,
do any of your patients call you Dr. Jiu-Jitsu?
Some actually do. It's pretty yeah.
That's awesome.
Some do.
That's funny.
Or Dr. J a lot because people can't say Jimenez. But yeah, some patients call me Dr. Jiu-Jitsu, and I try to like promote my newsletter and different things that I do so that it's because I post about knee pain and shoulder pain, and I try to answer common questions and I have a bunch of videos on questions that patients ask. So I try to always send people to it to be like, hey, look at this stuff, and then we can really have a good talk because you'll have a basis for what we're going to talk about.
Oh, that's really cool.
Yeah, you have such great stuff out there.
Super good. So when you got your black belt, tell us how that felt. What did it mean to you to actually, like, of course you got to know what's coming at some point, but when it hits, what was it like?
So I knew I was earning it. It was funny because my newest professor now, I'm in Washington State now. So, Stephen Galvez, I call him Professor X because it's a funny story. So I call black belts professor because to me, it's like, you're like a doctor, right?
Right.
When people come in and they're just like, hey, Meagan, like my patients or something. I'm like, okay, like that's cool. And, I've worked pretty hard to be a doctor. And so that's how I feel when I see black belts. I'm like, you work freaking hard for this. And so I call everyone professor, but that's not the style of the gym here. Everybody just goes like Steven, this, that. And so he was like, can you please stop calling me professor? I feel like the X-Man guy, like the Professor X. And so now I just call him X and Professor X because he's the X-Man wheelchair guy.
I love that.
I joined this gym last August, and when I met him and we were rolling, and he was just like, how are you not a black belt yet? I said, listen, this is my 4th gym since I started because I move a lot. I've had surgeries. I've been on hiatus a bunch. Like, it's going to come and it's fine, and I'm in no rush. And so he's like, all right, well, you're going to earn it here soon. You can't really fight it anymore. And I was like, can I just compete a little bit at brown belt? And he was like, fine, but like, it's going to happen and you can't run away. And so I was like, just give me a heads up because my parents and my aunts will be really upset if they can't be there. So like January or February of this year, he goes, all right, it's going to be May. And he gave me the weekend. And so my whole family flew out from like Texas, from New Jersey.
I love that.
Oh my gosh.
That's so really special.
Cool. Yeah. That's and then like earning it was great, but I didn't really feel it for a couple of days. And it was when my best friend texted me, and she earned her black belt last year. And she's like, so how does it feel? I was like, I don't know. It feels the same. I teach Tuesdays and Fridays. I've been coaching. I've been doing things. Like, I study a ton. I don't think that's much different. And she's like, well, for me, it was different. It shows like 17 years and all these surgeries I've had and all these things I've overcome and 3 diplomas. And it's like, well, when you put it that way, I guess.
It's incredible. Yeah.
Like, I started as an intern, and now I'm a full-blown doctor, like treating in the Army, which I never really saw coming. I kind of thought I would do it, but never committed fully until now. And so, yeah, it's kind of just like what's gone on in life and like all the things I've accomplished.
Yeah, that's incredible. That's so incredible.
That's the words I needed from the brown belt. You asked me that question earlier, and that's it.
There you go.
I love that. So how has your, as you've developed through your medical career and, progressing in your jiu-jitsu career, how have you seen the developments, and how has the way that you lead or train others changed as you've progressed? Like, whether that's in the operating room, the gym.
I think one of the big things is my mind, like mindfulness, my mindset, and how I approach things. And I hired a life coach. I think it's been 4 years now. Yeah, he's been my life coach. And Ray is the man. I recommend him to everyone.
You give him a shout out. What's his name?
Ray Chaffardini.
Okay. Where can people find him?
mycoachray.com. Or if people just go to my stuff, like, I post about him all the time. Like, I'll put his stories on my stories because I just believe in what we've accomplished over the past 4 years. Like, I'm a totally different, he hates when I say this. Like, I'm a totally different person. It's not that I'm a different person, it was always there. It's just that he's changed the way I look at the world and how I treat others and how I deal with things internally and thoughts. And I was always well accomplished, but I never felt fulfilled. And after working with him all this time, I'm feeling more fulfilled, and I try to instill that in other people now. So, for example, also when I was a resident coming up the ranks, it was always very hierarchical. And your chief residents, your attendings, people above you, if you did something wrong or said something wrong, it was just like a straight bash. So, no, that's wrong. Like, you're not right. It's only this way or the highway. And even in jiu-jitsu, sometimes, people teach things and you do something a little different. They're like, that's not how you do it.
Yes.
And so now I've learned to take a breath, look at people and be like, that could work. That totally is great. And be more open-minded. And it's totally changed the way I teach, the way I approach things. I try not to just be very quick to shut things down, which was how I was trained like my whole life. It's like, no, that's not right. It's very quick. People were very quick to say, no, that's not how you do things. And now it's just more open and more of a positivity. If something's really wrong, I'm going to say it. I think it's just the way I deliver things that has really changed.
Yeah. That's so cool. Yeah, I love that.
I'd like to talk a little bit about your deployment. It's coming up. It's your first one, or have you deployed before?
Yep, it's my first one.
So how are you feeling about it? What are you doing to prepare yourself? Is it really mental? How are we going into this?
How do we feel?
How do we feel about this?
I think it's closer. It's kind of like a little nerves, a little excitement.
Mm-hmm.
I don't know exactly where I'm going. I just know it's going to be hot. So mostly I'm a big planner. So it's mostly just getting things together that I think I will want or need, mostly food, because I really like my food. And it's a lot of like jerkies and tuna and minimally processed things. And I sent my electrolyte powder. So it's mostly been me preparing for what I could need. And like workout stuff that I can easily bring with me, like BFR bands and workout bands and anything I can bring and put in a bag, like is going. And it's a lot of work at the hospital because I'm trying to make sure everybody gets treated before I go. So like my wait list, I did like 10 surgeries the other week, which is a lot in the military because it's not very efficient. So I was like busy as hell the whole week, but I'm just trying to get everything in before I go.
Yeah.
So I haven't had too much time to like sit and reflect much, which I do need to do. It's also helpful that my fiance is in the military and he's deployed, I think like 4 or 5 times.
Okay.
So he's like, yeah, you need that. You're fine. It's fine. So he's
That's really nice.
Yeah, he's been a huge support and very helpful because he's going to hold down the fort in the house and the dogs and like take care of the stepkids when they visit. So it's really been tremendous that I don't have to worry as much about him.
That's nice.
Being back, I think a lot of times people probably worry about their loved one alone for that long. And he's like, it'll be fine. Like I've done it before where I've been deployed and so it's very helpful.
Wow.
That's really nice.
What does your fiance do in the Army?
He is in the infantry.
He's in the infantry. Okay, cool. And how long has he been in?
He's been in 15 years. So he's got a couple more to retire. Yeah.
How did you guys meet?
On Hinge.
Oh, I love that for you.
Yeah.
It's like how
before
cool
I joined the military.
Okay. And were you both into jiu-jitsu when you met, or did you get him into it?
No, so funny story on like one of our first dates. I think it was probably our second date. I was like, hey, by the way, I joined the Army, like haven't started yet, but going to be signing the papers soon and leaving for Washington because we met in Georgia. And he was just like, okay. I was like, really? I was like, yeah. I said, all right, perfect. Next area that I need to chat with you about. I train jiu-jitsu and I go most nights. So I work all day, usually come home, go to jiu-jitsu. You don't have to train. I was like, and it would be really cool if you did, but don't feel obligated. You just have to be okay with me going.
That's basically the story I got too.
Yeah, I've had relationships where they were like, what do you mean you're not going to be home tonight for dinner? It's like, no, we talked about this. Like, I go to jiu-jitsu. So he was like, okay, well, I used to train 5 years ago, and he was a blue belt like 5 years ago. He's like, I haven't trained much. I've been busy with the military the past 5 years, but I'd be willing to do it again. And now he's like just as into it as I am. We're both really nerds. Like we just study all the time. He'll call me. He called me when I was in San Diego. He goes, hey, could I like get to a false reap from single leg X? And I was like, he just called to ask me that. And I was like, well, like maybe, I tried to be open, like maybe not the way I would do it, but and he's just like, okay, love you, bye.
That's awesome. That's so great.
Oh my gosh, he's taking full advantage. He's like, he's got the encyclopedia on.
I know. It's hilarious because people are like, what? How did you learn to do this shit? He's like, oh, I have a pocket demon at home that shows me all this stuff.
That's so great.
Oh, that's awesome.
Yeah.
So what do you feel like, what lessons has jiu-jitsu and medicine given you that you think you'll take into like the deployment with you? What are you going to take from those things into that new environment for you?
Oh, that's a good question. I think from martial arts in general, it's just kind of discipline, like staying focused, understanding that sometimes things suck and that sometimes you do have to put your head down and go. But most of the time that should not be the case. And I still would like to enjoy the deployment. That's my goal. Like, hey, enjoy the time with people I have a really great group I'm going with. It's a forward surgical team, and it's 20 of us, but then we split into 2 units. So it's going to be 10 and 10. And just like enjoying the time with those 10 people, learning as much as I can, teaching as much as I can, working out as a group, and like enjoying it, right? I don't like going to things because I did it in medical school. I did it in residency, like just another 5 years and then you'll be at the next stage, just another this and then you'll be done. I hate that. And I did it. And so now it's like, there's probably going to be a lot of parts that suck. And it's like, where can I find the positivity and where can I enjoy the process while it's happening rather than just being like, oh, I can't wait for it to be 4 months for me to be out of this place. So that's my biggest goal. Is just to enjoy it because
great mindset.
Yeah, that was
otherwise your life passes you by.
Yeah.
Med school, I did it. It's like 4 years, and I enjoyed medical school with my friends. I found myself a lot of times saying 3 more years and this will be over, 2 more years and this will be over, and then you get your diploma, and it's like, okay, I'm a doctor, now what? Right?
Yeah.
It's like I thought this was going to be a lot better, versus enjoying the moments, and I think that's what made the black belt so great. It's like I really enjoyed the process, and now it's like cool. I'm a black belt and like we're just getting started.
Yeah,
that's amazing.
Oh my gosh.
That's I like kind of have chills a little bit right now.
Same. I was like, woo.
I just feel like these are just such amazing, accomplishments. You've done so much. And that's kind of a good segue into what we want to talk about next is not only are you about to deploy, not only are you a surgeon, a black belt, but you are also like have a book coming out. You started a podcast. Yes. You are Dr. Jiu Jitsu. So what inspired you to start that?
I think just what we talked about, the culmination of the 3 things that kind of embody me. It's like mostly jiu-jitsu, orthopedics, and then kind of the military component, but more so jiu-jitsu and orthopedics are where the brand came from. And just feeling like I wanted to put more education out into the world for athletes. I would have a lot of jiu-jitsu athletes come in, or just athletes in general, be like, hey, what happened to your knee? Like, you had surgery in the past? They're like, yeah, something about my ACL. It's like, okay, what about it? Like, what kind of graft did you have? Did you have meniscus pathology? It's like all the questions. Who was your surgeon? And they're like, oh, I don't know any of that. I just know I had ACL. Like an ACL injury. And I find their op note somehow, and it's like, you didn't even have an ACL, something like that. So just having people be more educated about these things and like when injuries do happen, because we do a physical sport, like injuries happen. And, a lot of people come to me and they're like, hey, my knee popped or this, that, and I'll examine their knees and things. And I'm like, hey, like now I've got this newsletter, go check out my newsletter. I have a podcast. Like I have an episode coming out all about ACL injuries. And that way I just can give more education to people when they have these things happen, because something's going to happen, right? We're going to get injured. Hopefully we can keep it to a minimum. And I've got a lot of good friends out there that are doing great things in the PT world and educating on prevention. But even with all the prevention, it happens. And so my goal is just to help people kind of settle their minds, get more educated about their injuries.
What would you say that your most receptive approach to helping people get through injury and grow and move forward in their sport? Because, you got to test a few out, and you mentioned that there was some trial and error growing into this. What do you think the best approach is?
For helping people like recover from a surgery?
Right. Or for even just a minor injury, they're, sprain that doesn't require surgery. They're coming to you thinking that, something's wrong. What do you advise to them?
Well, the hardest thing with athletes, especially jiu-jitsu and any fighters, is taking time off.
Right.
Nobody wants to take time off. So I'm trying to figure out now how we get people back to the mat safely and quickly by potentially like just altering what they do. So if you have, like, for example, I had a biceps injury and I wanted to be back on the mats teaching. So after 4 weeks, once I came out of the sling and had good motion and was like, had minimum, like good strength, decent enough, I got back to teaching my classes Tuesdays, Fridays, but I had to tell my partner, like my one good friend, Katie, said, I need you to be my uke, please, but just don't touch my right arm. And if you see me doing something crazy, stop me. So just having friends that will help me protect me against myself too is huge. And then I was like, okay, well, we're going to just work on my other arm, and I'm going to just do all my ankle locks and my heel hooks on my other arm, and I'm going to use my legs. And so also training with my fiance, he would just like kind of try to elevate me when I was starting to roll early. Okay. Very, very slow rolls. And he would make sure I didn't fall onto my right arm. Right. So it's just having partners that are willing to do that with you is huge. And getting people back into the community early is huge, because after an ACL surgery, 9 to 12 months not competing in something that you are very adamant about is very difficult. Yeah. So my biggest thing is getting people back onto the match early, even if it's just sitting and watching, even if it's just being around the community. There you go. Or like, how can we adjust what you're doing so that you can still be a part of everything without hurting yourself? And some people that's not possible. Right? Some people are all or none. And so it's like, all right, then you just need to sit out, but you can still go. You can still be a part of the community.
Absolutely.
Yeah. So where do you hope to take your work in the future, with Dr. Jiu Jitsu and the podcast? What do you see down the road?
Well, in the future, my fiance and I have chatted about like retiring to Costa Rica or somewhere warm. I know. And just like opening up a gym like that involves or that incorporates jiu-jitsu, cross training, lifting, therapy, massage, like ice baths, recovery, just trying to have like the whole gamut. He wants to have a kitchen and be able to cook food, because if you go to Brazil and train, a lot of them have kitchens. And they have like somebody's mom in there making eggs after morning training. And, oh, wow. And, you pay them. In Brazil, it wasn't expensive, but you pay them and they're like, here's your coffee and your eggs. And so we've talked about, a lot of it is still just in the very much, dream stage. Yeah. But you have to put it out there.
I love this.
Yeah. That's the goal someday. I don't know when I'll retire from medicine or if I will. And if I can't leave orthopedics, we could always do like Puerto Rico or, somewhere in the US where I could still practice, because it would be very challenging to practice in Costa Rica. But, there's dreams.
I love all this. I cannot wait to see what happens for you in the future. I think that you're just so fascinating, and obviously you have so much to offer the world. So you are having a book come out this year, correct?
It will probably be next year.
Next year, okay.
Yep, we're done with the editing phases. I'm working on reading through it one more time, and then beta readers are like people I'll send the book to read, my target audience to see, hey, what worked for you, what didn't. So I've got a couple beta readers in mind I'm going to send it to. And
my gosh, I volunteer to be a beta reader.
So perfect. Perfect.
I volunteer as tribute.
I'm dying.
It's a pretty good job to just kind of chill on the beach and read.
It looks so interesting.
Honestly, like I said, I've been creeping on you, and I mean, just so for people listening, Dr. Jiu Jitsu, a combat athlete's guide to mental strength and physical resilience. Like, hello, it sounds
get it on the
amazing. So I've signed up for the updates and stuff, so I can't wait to get my hands on that whenever it comes out.
So cool. I'm so excited to see this.
Yeah, so you're just incredible. We like to close out our podcast with a little rapid fire questions. How do you feel about that?
Perfect. I listened to your interview with with Jiu Jitsu Grandma.
Oh,
she's so cute. Yeah,
I listened to
her rapid fire. Yeah,
she's the cutest. I've
met her before. I was down in Georgia and I trained in Alabama. I think she's in like Pelham at the Gracie Baja there.
Yeah, she's so cute. I love her.
I'm looking forward to finding her somewhere.
Yeah, we're going to find her at Master Worlds this year.
Yes. Yeah.
Will you be there?
No, I will be in another country.
That's during deployment. I got you.
Yeah, okay. But I think fiance will be there, so go find him and scream at him for me.
Yeah. Well, I would love it. I mean, we're all Pacific Northwest, so I would love it if our paths could cross someday.
Yes.
All right. Well, let's get into our rapid fire. So we'll do some.
I'm ready.
Some regular, some jujitsu, some surgery. We'll see. Okay.
Perfect.
We'll start easy. I think I know the answer to this one already because you mentioned it earlier. But dogs or cats?
Dogs.
Staying in or going out?
Ooh. This has changed in my life. I used to be a party animal. And then around like 32, I slowed down. And now it's staying in 100%.
Yeah.
Relatable.
Winter or summer?
Nobody wants to get dressed up,
That's fair. Sweatpants all day.
That's right.
That's why, scrubs. I love wearing scrubs to work every day. Sweatpants.
Oh my God. My mom says I got into surgery because I wore pajamas to work.
That's what I tell people about my job.
Yep.
I straight up admit it. I'm like, yep. That's funny. Okay, so early bird or night owl?
Early bird.
All right. Coffee.
That's changed too.
That's
over
changed
time,
too.
Yeah, I used to be a night owl, and now I just I'm like, nothing happens good after 9 p.m.
I've heard that before.
I agree with that.
What is your favorite surgery to perform?
I think ACL reconstructions, because there's so many ways to do them. And I had a mentor say there's no surgery you can mess up more than an ACL reconstruction. Because there's so much detail that goes into it. Yeah.
Very cool. What is the longest surgery you've ever been a part of?
Probably a multi-ligamentous knee, which is like you guys probably hear mostly about ACLs tearing. And I had a good laugh with my friend that's like, were ACLs only made to tear? Like, is that why they were created? It's like, it's not a bad question. Like, but they are important, and we need to talk about what they do well. But the longest surgery is you can tear other ligaments in the knee. So there's like ACL, PCL, so the front in the center, and then there's MCL, LCL on the inside and outside. And multi-lig means you tear multiple of them. Those surgeries are quite long, and sometimes we divide them into 2 surgeries.
How long do you think, roughly?
It depends. It just depends on what happened, the person. I had a patient in fellowship with a BMI of like 49 jumping on a trampoline, and she dislocated both of her knees. And so she was morbidly obese with many ligaments and her meniscus torn. And it was probably about a 5-hour surgery. It was ACL, MCL, and then a bucket handle meniscus, which is where the meniscus tears and flips. So it was a long surgery.
If you could see our cringes right now.
I am picturing this literally happening in the joint, and I am like mortified for this poor woman.
I did not want to treat her operatively. I was like, can we do this non-operatively? That is a big leg, and that is a lot of damage. She had that meniscus flip, so she couldn't bend her knee, and it was kind of stuck. And the other knee we were going to treat non-operatively because she didn't have that. So we were like, I treated this one. It was very taxing. It was a lot of work on my body too, right? Manipulating that leg and then doing all the work. And so after that surgery, I left fellowship like later that year. And then the fellow the next year called me and he's like, thanks for doing that one side because now she wants the other side.
Oh, no.
Oh, damn it.
Oh, my gosh.
She did well. And I was like, good luck.
Well, good work, Doc. Wow. What would you say is the most underrated recovery trick?
Sleep.
That's really good. I need to work on that.
I'm literally speechless right now. Duh.
What is your biggest pet peeve?
It's so easy and it's free. But the problem is that everyone struggles with sleep. Like,
it's true.
I don't know one person, well, maybe a couple, but that just are like, yeah, I can sleep anywhere. It's so easy. It's like, you're either tough to go to sleep, you wake up in the middle of the night. Sleep is really hard. And there's so many things to optimize sleep, and that's a whole other topic. But everybody wants like to pay all this money for all these hacks and supplements and this, that, and the other. And it's like, no, just take a nap.
A nap can solve so much.
Daily. My husband literally sleeps every day for 2 hours before jiu-jitsu.
Oh my God.
Super
that sounds
annoying.
Glorious. I napped when I was in San Diego because I had the time and I didn't have responsibilities of home. And so I was taking a 30-minute nap after I went for a trauma course. After the course before jiu-jitsu, oh my God, what a difference. It's just tremendous.
Nice.
All right, I've got a few more for you here. What is your biggest pet peeve with patients?
Ooh, biggest pet peeve. I think when people say they don't have time for something, that's a tough one. That I think it also is. It probably triggers me too because I have a lot of baggage around that. It's like, oh, you should do this. Like I don't have time for that, right? And it's very easy, and people say it very quickly. And we all have a lot of responsibilities. And some of my patients, their units are putting a lot of pressure on them. Or some of my older patients, like with rotator cuff injuries, the veterans are taking care of family members who are really sick. And they're like, I don't have time to do recovery. It's like, you can't care for your loved one if you're not okay.
Yeah.
Right. So that's a big one for me.
Yeah. How about your biggest pet peeve on the mat?
Oh, okay. That's a good one. So no-gi, I teach no-gi Tuesday, Friday night. When people don't wash their feet before no-gi in particular, it's a big, I'm like, okay, I can smell feet.
Like you.
In the morning, you're probably okay, right? You took a shower at night, whatever, you just woke up, but you've been in boots or working. I sweat in the operating room when I operate a lot. So I go home before I teach on Tuesdays because I operate Tuesdays. I go home, even if I only have 5 minutes, I take a quick shower and wash like my body and my feet. So that's a big one for me. Like you came straight from work, we have a shower here. Just wash your feet.
What's your favorite submission?
Oh, probably a heel hook.
Okay. And what's the best place you've ever traveled?
Probably Brazil.
Awesome. Favorite sport outside of the combat world?
It used to be football. It's probably more hockey now.
Okay.
Because I worked with the Blues when I was in St. Louis.
Oh, very cool. That's awesome.
And those athletes they're like fighters. They're
a different breed.
They do fight, right?
Oh my God. They have some other level of like mental strength, and they'll get injured and they're just like, I don't care, I'm going back in.
They are a different breed of humans.
Insane.
Oh yeah.
Yeah.
So probably like playoff hockey, which is happening right now. My Blues lost, so I was pretty bummed last weekend. But I used to watch a lot of football, like Saturday and Sunday, college and NFL. And I got so into jiu-jitsu when I was over at Emory and started competing again after like 7 years of not competing. And so I just watch jiu-jitsu now.
Okay.
Nice.
So I have to ask, being from New Jersey, are you a Jets girl?
Giants.
You're Giants. Okay. Well, I'm from upstate New York, so we are the Buffalo Bills household.
Okay. Very good.
But I always have to ask because we just call them the New Jersey Jets because the Buffalo Bills are the only true New York team because they are the only ones that play in New York. So
hey, I agree with you. And the Giants play in Jersey, so
exactly.
New Jersey will take them.
So the Bills Mafia, we take pride in being the only New York team.
You're not wrong.
But I will continue to plead her case here too.
But I like that you're a Giants fan because it's a different division than the Bills. So good work there. Very cool. The last question I always ask everybody is if your best friend had to describe you in 3 words, what would those 3 words be?
Crazy, savage, and ridiculous.
I love those 3 words. I mean, you just say those words, I'm like, I want to meet her.
If Whitney's one of my best friends, and her and I are like 2 peas in a pod. But I have a lot of best friends from like childhood. I've got my 2 best friends, Mike and Mike, that we grew up together, and they probably all describe me that way.
Yeah. How would your fiance describe you?
Oh God. I don't want to know. Probably pretty similar.
We'll have him on the pod sometime. We'll get his side of the story.
The follow-up.
He thinks I'm pretty ridiculous and very energetic.
Yeah. Oh, I love that.
Oh, man. Well, Meagan, thank you so much for doing this. Do you have anything else that you want to add?
Oh, we want to get you all your plugs. So where can people find you?
Oh, yeah. Instagram, Dr. Meagan Jimenez. And then my new website actually just came out a couple weeks ago. It's either drjujitsu.com or I have meaganjimenez.com. I got both domains, so they both bring you there. The tricky thing is DR Jiu-Jitsu was already taken, so I spell it out as Dr. DOCTOR.
Gotcha.
Because if you do DR Jiu-Jitsu, it goes to another page of someone. So that was taken, so I kind of changed mine up a little bit. And then I'm on LinkedIn as well. And I just started a newsletter that comes out every Monday. You have to go in through LinkedIn, but you can subscribe through my website. And if anybody has anything they'd like to hear on my newsletter, I'm super open to suggestions and questions people have, so I can plan on my future newsletters on Mondays.
Amazing. And your podcast is called Dr. Jiu-Jitsu as well?
My podcast is going to be Meagan Jimenez. It's through YouTube.
Okay.
But again, everything is on my website. So if people like my LinkedIn, my Facebook, everything is from my website. So that's the easiest kind of place to go.
Beautiful. And it is a really nicely put together website, and everything that you have on there is great. And I've enjoyed looking at all of your content so far, and I look forward to seeing what is next for you.
Yeah.
Thank you. I got a shout out to Hussein for that. My buddy Hussein put on my website, and
amazing.
He kind of like got me into all the podcasting, and he's been awesome.
Oh, that's great. He's doing a great job for you, for sure.
Yes.
Oh, awesome.
Well, good luck with your upcoming deployment. Good luck with the podcast and everything. When do you deploy?
June 11th.
June 11th. Okay. Well, we will be thinking of you, and we'll probably put this out a little bit before you take off. And
awesome.
Yeah, we're so happy to have chatted with you, and we hope we get to meet you in person someday.
For sure.
It'll happen. And thank you guys for doing this. The podcast is really awesome. Just like spreading people's stories and everything through jiu-jitsu.
Yeah, thank you so much. It's a passion project, and we are so glad that you're doing your podcast, because you obviously have so much to offer.
Well, thanks, guys. Thanks again for having me.
All right, no problem. Thank you. We'll catch you next time.
Bye.
Bye.
Don't forget to like, subscribe, and share. Check us out on Instagram at Chokeholds and Chill Pod, or shoot us a message at chokeholdsandchillpod@gmail.com.